Welcome to our program. Today we are discussing nursing care plan. So we have two problems, an actual problem and a potential problem. So we'll start by an actual problem. So an actual problem that we have is hyperthermia. Okay, so hyperthermia, that's our problem. And the nursing diagnosis will go like this. Hyperthermia related to infection evidenced by a temperature of 38.1 degrees Celsius. Okay, so remember, a nursing diagnosis should have three things: a problem, which is hyperthermia, okay, an etiology, which is an infection, and also a characteristics, which is a temperature of 38.1 degrees Celsius. Okay, now what will be our aim? Since now we've seen the temperature is the 8.1 degrees Celsius, what will be our aim? So our aim will be to reduce patient's temperature by 1 degree Celsius within 1 hour. So I'll say patient temperature will reduce by 1 degree Celsius within 1 hour. That will be our aim. Okay, now how are we going to achieve this aim? Okay, number one, I'll say I'll remove excess linen or clothing in order to reduce temperature by convection. The second intervention, we say I will do tepid sponging. Okay, I will do tepid sponging in order to reduce temperature by evaporation. Okay, the third intervention will be I will administer prescribed and pyretics in order to act on the hypothalamus and normalize the body temperature. Remember, the hypothalamus is the temperature regulating center. Okay, so after these interventions now, I will need to evaluate. I will come back after 1 hour to see if I've achieved my goal. Okay, so my evaluation will be patient's temperature reduced by 1 degree Celsius in an hour or within an hour. Okay, then it will mean that I've achieved my goal. All right, so that was an actual problem and its interventions. Now the second problem is a potential problem. It has not yet happened, but there's a risk that this problem may happen. Okay, so we are saying risk of pressure sore formation. Okay, it's not there, but there's a risk that the pressure sore may fall. Okay, so the nursing diagnosis will be like this: risk of pressure sore formation related to patient confined to bed. Okay, so now this patient is confined to bed, prolonged bedridden. There's a risk of developing pressure sores. Okay, remember this one doesn't have an evidence because it's not yet there. Okay, so what will be our aim? Okay, so our aim will be pressure sore formation will be prevented during hospitalization. Okay, so that will be our aim. Okay, and now how are we going to achieve this aim? We will say I will change patient sleeping position 2 hours to relieve pressure from bone prominences. Okay, or relieve pressure from pressure areas. Okay, so the second intervention will be I will do pressure area care to prevent injury in pressure area points. Okay, so remember pressure area care, it also includes inspecting those the pressure area points. Okay, so what will be our evaluation? Maybe this patient has stayed on the ward and we are discharging now, we need to evaluate. We say pressure sore formation prevented during hospitalization. Then it means you have achieved your goal. Okay, that was our topic today. Next time we'll come with another good topic. Until then, bye bye.